Welcome to Cycle Wisdom, a brand new podcast where we empower women to restore natural cycles to improve health and promote fertility. I am your host, Dr. Monica Minjeur, and I am so glad that you found us and are listening in today. I am a family medicine physician with specialized training in women's cycle health, and I am so excited to be launching this podcast and also to introduce my new practice, Radiant Clinic, which I'll talk more about a little later in the episode. To start off with, I want to give you an opportunity to hear a little bit more about my background, as well as why this podcast was started as a source of education for the kind of care we provide at Radiant Clinic. So let's get started. I grew up on our family farm in Northeast Iowa. I'm the oldest of 5 children, and my parents raised us all to work hard and to serve and care for others. They also taught us about managing a business with farming. And when I was in high school, they started a business that they still own to this day with one of my sisters and her husband. Although my career path started off a bit differently, I have seen firsthand the benefits of entrepreneurship and have been inspired to learn more and set off on my own adventure in business ownership. After high school, I attended undergraduate at St. Louis University. I always knew I wanted to do something in the healthcare field, and there were so many options available there to choose from. St. Louis University offered a really great opportunity to expand my horizons and see what was out there. I had a fantastic admissions counselor who encouraged me that I could really major in whatever I wanted to and still keep on this medicine track. So I ended up majoring in theology, minoring in biology, and my elective classes kept me on the pre-med track with the intention to continue on to medical school. After my undergrad work was done, I was accepted to medical school at Kansas City University of Medicine and Biosciences. This was one of the defining moments of my educational career, as I did apply only to osteopathic medical schools. Now, for those of you who may not know the difference between, what's an MD versus a DO, the short answer is that there's a difference in our training, but not in what we can do and how we can practice, at least here in the United States. Most of the osteopathic schools focus really on more of a holistic approach to healing, and that was something that really appealed to me. After graduating from medical school, I chose to pursue a career in family medicine and completed a 3-year residency program in Mount Clemens, Michigan, which is a suburb of Detroit. During my time in residency, a close family member about my same age was diagnosed with a blood clot in her leg. She had been taking birth control pills in an effort to try and regulate her erratic cycles. The blood clot created serious issues that needed to be treated with other medications, and she obviously wasn't able to go back on hormones for risk of another clot forming. I knew there had to be a better option for treating her cycles and eliminating the inherent risks of hormonal contraceptives. I began to develop a greater interest in women's health and, on my own, learned more about fertility awareness methods and other options for treating women's health concerns. I came to know more about the Creighton model, which is a method of charting cycles, as well as NAPRO, or Natural Procreative Technology. NAPRO is a structured way for medical professionals to review those charts, then work through diagnostic and treatment plans to create an individualized approach to dealing with menstrual cycle irregularities or concerns. I decided to get additional training as a NAPRO technology medical consultant during my residency training, so I enrolled in a program through the St. Paul VI Institute in Omaha, Nebraska. One of the really great things is that I had that training straight out of residency, so when I started my first job, I was able to incorporate NAPRO technology into what I knew from my traditional education background. This was what I needed to continue practicing medicine in a way that I feel is truly holistic, gets to the root of the underlying menstrual cycle irregularities or fertility concerns, and doesn't inflict as much risk for side effects. Now, after residency, I moved back to Cedar Rapids, Iowa to be closer to my family and joined a general family practice clinic, incorporating NAPRO technology from day one. For the past 11 years, I have enjoyed working with an amazing staff and serving wonderful patients. And I've been able to carry out this commitment to both evidence-based medicine and patient-centered care in a way that I felt was best for patients. I combine a more holistic approach when that is appropriate, utilizing conventional medicine when that makes more sense, and specifically in regards to women's health concerns, helping people to find answers in regards to their menstrual cycle concerns in a more natural way that didn't include birth control or artificial hormones. Although I have enjoyed general family practice, I have come to realize that there's a growing need to do more in our community, especially in the realm of natural women's health care and fertility. I have cared for many patients who are living with irregular menstrual cycles, debilitating pain with their cycles, menstrual migraines, PMS, as well as people dealing with the side effects of being on hormonal contraceptives that were supposedly trying to correct those underlying issues. I've also worked with those struggling with cystic ovaries, infertility, or recurrent miscarriages, many of whom have come to see me after seeing multiple specialists with no actual diagnosis or no clear path forward. Some have been on elaborate treatment regimens, which were either not helpful or had horrendous side effects, and there are so many unknowns still out there. This can be a really dark time for women with no clear answers, and they don't know where to turn. That's why I decided to create Radiant Clinic as a way to bring light into that darkness, to bring hope and answers where there are none. One of the mainstays of our mission is to provide personalized care plans tailored to each woman's specific needs and goals. More importantly, I want to provide education to you, our listeners, and to our medical community that there is a better way forward for natural women's healthcare that doesn't leave us vulnerable to potential side effects, long-term consequences, and unanswered underlying diagnoses. I will continue to use each episode of this podcast to discuss specific medical conditions that can be treated more naturally. Our focus will be providing answers to common misconceptions that are out there and to promote natural fertility awareness methods, no matter where you are in your menstrual cycle journey. My husband and I recently were able to spend some time with family, and we had a conversation talking about the mission of Radiant Clinic, how it would serve people, and how the single focus is on finding the root cause of underlying menstrual concerns. We talked about really addressing those concerns, getting the appropriate diagnosis, working through a treatment plan together, and modifying it as we needed to as we went along. And my dear cousin said to me, "Well, isn't that how all health clinics provide care?" And my response was, yes, it absolutely should be. But unfortunately, that's not necessarily the way healthcare is actually delivered at this point in time. But it's time for a change. You know, I've personally seen, diagnosed, treated, and walked with women along every step of this journey, and I've had the immense privilege to see how providing this unique level of care can help change lives. If nothing else, we're providing answers and starting women on a path to healing, both physically and emotionally. Now, if this sounds like the standard of care you would like to receive, I would invite you to visit our website at radiantclinic.com to learn more about our unique model of care. You can schedule an in-person appointment to see me in the Cedar Rapids area or arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please remember to subscribe so you don't miss any future episodes. And as always, share this podcast with someone in your life who needs to hear it. I promise not to talk so much about myself in future episodes, but I am looking forward to digging deeper into the issues that so many women are facing in regards to their menstrual cycle health and fertility. I sincerely appreciate your trust, and I look forward to sharing more with you on our next episode of Cycle Wisdom.